Hi. Hello, my name is Whitney. I'll be performing. My name is Whitney. I'll be your student nurse today. I'll be performing a physical assessment on you as well. And first, I'm going to go ahead and I'm going to check your name and date of birth on your wristband. Could you please tell me your name and date of birth? Okay, perfect. Patient appears to be stated age. All right, next I'm going to observe my patient's facial expressions. Facial expressions appear to be normal and appropriate. Patient does not exhibit any signs of distress or pain. The patient's behavior is appropriate. I'm also going to assess my patient's hygiene. Patient has recently showered and hygiene is appropriate. Patient appears to be well groomed. I'm going to assess my patient's posture. Posture is erect and symmetrical bilaterally. At this time, I'm also going to have my patient assess for gait, and I'm going to have my patient walk to the front of the room and back, and patient appears to be symmetrical bilaterally, and gait is even and steady. Okay, next I'm going to assess my patient's level of consciousness. So can you tell me where you are? Can you tell me why you're here? What month is it? What day is it? And who's the president? Okay, perfect. Patient is alert and oriented times 4. Um, Next, I'm going to assess my patient's vital signs. And I'm going to start with the apical pulse, and I'm going to listen to the apical pulse for 1 full minute. And I'm going to listen at the fifth intercostal space, left of the sternum and lateral to the midline. Okay, apical pulse is normal and at an 88. Next, I'm going to check the patient's radial pulses simultaneously, checking for rate, rhythm, and force. Okay, normal +2. Next, I'm going to check my patient's blood pressure, and I'm going to assess blood pressure, placing the blood pressure cuff over the upper arm and ensuring that the tubing is over the brachial artery. Okay, blood pressure is normal, 120/80. And now I'm going to put on gloves and I'm going to assess my patient's temperature orally. Okay, temperature is normal, 98.3. I wouldn't assess the patient's temperature orally if the patient had anything hot or cold to drink or eat within the last 15 minutes, or if the patient was just recently chewing gum. I could assess my patient's temperature tympanically. However, I wouldn't assess it tympanically if the patient has any signs of ear infection or has any drainage or pain. And then I could also assess my patient's temperature in the rectum, and that would also not be completed if the patient has maybe had any recent rectal surgery. Okay, now that I have assessed my patient's vital signs, I'm going to now move down to the head, and I'm first going to inspect the shape of the head. The shape of the head is normal cephalic and atraumatic. I'm also going to inspect the face. Face is symmetrical. The lips are pink and moist. And the skin color is appropriate to patient's ethnic background. Now I'm going to inspect the patient's hair. Hair is abundant. I don't observe any cuts or lesions, any flakes or abnormalities. Our scalp is normal. Now that I've done that, I am going to assess my patient's eyes. Eyebrows are intact. Eyelids are intact with no abrasions. I don't observe any lacrimal drainage. Eyes are aligned and symmetrical bilaterally. And I'm also going to inspect my patient's sclera. The sclera is white, and the conjunctiva is clear. Now I'm going to assess my patient for perla, and I'm going to dim the lights first. Okay. All right. Perla is present, patient. I'm gonna check for accommodation as well. Could you follow the tip of the pen light? All right, Perla is present. Eyes are round, equal, reactive to light, and accommodating. Okay, now that I've done that, I'm gonna assess the patient's ears. I'm gonna inspect the auricles, and I'm also gonna be checking the lobules and the tragus for any pain. Patient does not express any pain in the ears. I don't observe any drainage in either ear. Okay, I'm gonna perform the whisper test, and I'm gonna whisper 3 words in my patient's ear and ask the patient to recite those words. Okay, and then I'm gonna transport to the other side, and I'm gonna whisper the 3 words in the other ear. Okay, could you please recite those 3 words? Okay, and during the conversation, I've also assessed my patient's hearing, and hearing is appropriate and intact. And patient does not exhibit any signs of hearing loss or having any issues hearing. Okay, now that I've completed the ears, I'm going to go ahead and I'm going to inspect my patient's nose. All right, the nose is symmetrical and is midline. I don't observe any deviated septum. I'm going to inspect my patient's mucous membranes. Mucous membranes are intact. I don't observe any abnormalities, and they are pink and moist. I'm going to, now that I still have my gloves on, I'm going to check for patency and flaring, which are negative, as I ask my patient, hold down one side of the nair and ask my patient to breathe in and out. And I'm going to do the same thing on the other side. Please breathe in and out for me. Okay, great. All right, now that I've completed that, I'm going to move down to the mouth. Lips again are pink and moist. I'm going to take my tongue depressor, and I'm going to check my patient's tongue. Tongue is pink and moist. I'm going to inspect the buccals. Buccals are again pink and moist. I'm going to have my patient say ah. Could you say ah for me? Uvula is intact and is midline and rises when patient says ah. I'm going to inspect the sublingual mucosa, which is also intact and pink and moist. Okay, now that I've completed that, I'm also going to inspect my patient's frenulum upper and lower, which are both intact. And I'm going to assess my patient's gums, and the gums are pink and intact. Don't observe any lesions in the mouth, or any buildup, or any white masses. Okay, patient's teeth are their own. I don't observe any loose teeth or any teeth decay. Okay, now I'm going to remove my gloves and discard of my tongue depressor. Now that I've done that, I am going to visually inspect the tragus is midline, as well as the substernal notch is also midline. Okay, and now I'm going to go ahead and palpate my patient's left nose, and I'm going to start with the preauricular, postauricular, submandibular, submental, tonsillaris, anterior cervical, posterior cervical, and supraclavicular, and occipital. Okay, the lymph nodes are not palpable. Now that I've completed that, I'm going to check my patient's range of motion in the neck, and I'm going to have my patient turn their head to the left, okay, and turn your head to the right for me, okay. And now I'm going to have my patient turn your head to the left with resistance and also to the right with resistance. Range of motion is appropriate. Now that I've completed that, is it okay if I go ahead and move down to the chest? I'm gonna have to remove your gown, okay? Patient is comfortable with that. I'm gonna inspect my patient's chest, and as I inspect the chest, I'm going to observe that my patient is a mouth breather. I don't observe the use of any accessory muscles or any retraction. Okay, patient's skin is appropriate to patient's ethnic background, and patient, I don't observe any distension or masses. Okay, now I'm going to inspect my patient for JVD, and I'm going to lay my patient flat, supine position, and I'm going to remove the pillow from behind the head. I'm going to ask that my patient turn their head to the left. Okay, I do see a slight pulsation. I'm going to have them turn their head to the right. I also observe slight pulsation. Now I'm going to lift my patient up to a 45-degree angle and continue to check for JVD. Okay, could you turn your head to the left for me? Okay, turn your head to the right. I don't observe any pulsation, so JVD is negative. And I'm going to go ahead and place the pillow back behind my patient's head. Okay, now that that is complete, now I'm going to inspect my patient's. Now that I've observed, now I'm going to palpate my patient's chest, and I'm going to palpate for any masses. Okay, and there are no masses noted. I'm going to also assess laterally. Okay, there are no abnormalities or masses or tenderness noted. Okay, now that I've completed that, I am going to palpate my patient's 5 cardiac landmarks, and I'm going to start with the second intercostal space right of the sternum, aorta, pulmonic, second intercostal space left of the sternum, Erb's point, third intercostal space left of the sternum, tricuspid, fourth intercostal space left of the sternum, and apical, fifth intercostal space left of the sternum and lateral to the midline. Okay, now that I've completed that, I'm going to auscultate my patient's lung sounds. Okay, and I am going to do this in the ladder motion. Breathe in and out for me as okay. Breathe in and out. 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 Okay, perfect. I'm also going to check my patient's lung sounds laterally. Okay, great. And then I'm also going to assess my patient's lung sounds posteriorly. Lung sounds are clear. I don't hear any wheezing, bronchi, or crackling. Now I'm going to auscultate my patient's 5 cardiac lung sounds, starting with the aorta, second intercostal, right of the sternum, pulmonic, second intercostal, left of the sternum, Erb's point, third intercostal, left of the sternum, tricuspid, fourth intercostal space, left of the sternum, and apical, fifth intercostal space, left of the sternum and lateral to the midline. Okay, now that I've completed that, I'm gonna move down and I'm going to assess my patient's, observe my patient's upper extremities. I don't observe any abnormalities. Skin is appropriate to ethnic background. I don't observe any lesions or abnormalities. Now I'm going to move down to the abdomen, and I'm going to visually inspect the abdomen. I don't observe any I'm going to inspect the abdomen for contour and symmetry, which is appropriate. Abdomen is symmetrical. Patient skin color is appropriate to the patient's ethnic background. I don't observe any scarring or striae, no pulsations, no bulges or masses. No petechiae, and patient's umbilicus is midline. Okay, now that I've done that, I'm also going to inspect the patient's genitals, and I'm going to inspect the genitals for healthy tissue which is present. There are no lesions. I don't observe any discharge or any skin breakdown. Okay, and I've also already assessed my patient's urine. Urine is normal, clear, and yellow. And I've also assessed my patient's stool. The stool is medium and brown. Now that I've completed that, I'm going to auscultate my patient's bowel sounds, and I'm going to auscultate at each quadrant. Lower right quadrant, upper right, upper left, and lower left. Bowel sounds are active. Bowel sounds are normal and active. And now I'm going to palpate my patient's abdomen, making sure that I check in all 4 quadrants and lightly palpate. Okay, and I'm checking for any pain, any tenderness, any distension, or pulsations, which are all negative. Now I'm going to cover my patient back up, and I'm going to assess my patient's capillary refills for perfusion. Okay, blood returns within less than 3 seconds. I'm also going to assess my patient's feet for capillary refills. Okay, all right, capillary refills. Perfusion is normal. Blood returns within less than 3 seconds. Now I've already assessed my patient's apical. I've already assessed my patient's radial pulse. Now I'm gonna palpate the carotid artery one at a time, checking for rate, rhythm, and force. Okay, normal. Now I'm going to palpate the popliteal pulse. Rate, rhythm, and force is normal, +2. The femoral pulse for rate, rhythm, and force, which is normal, +2. Now I'm going to palpate the posterior tibial pulse for rate, rhythm, and force, which is +2 and normal, and the dorsalis pedal pulse for rate, rhythm, and force, which is also normal, +2. Okay, I'm going to inspect my patient's lower extremities as well, for any skin breakdown, any lesions or abnormalities. The skin color is appropriate to patient's ethnic background. And I've also assessed the extremities posteriorly as well. Okay, now I'm going to assess my patient's gait. I've already assessed that, and I've asked my patient to walk to the front of the room. Gait is normal, even and steady. I'm going to have my patient perform the Romper test, and I'm going to ask if you could please stand up for me and place your feet flat on the ground and close your eyes. Okay, great. Patient is even and steady, and Romper is negative. Now I am going to have, I've assessed my patient's skin color throughout their body throughout the assessment, and skin is normal. Skin is warm and dry. Skin is warm and dry. Okay. Skin is warm and dry. Okay, now I'm going to inspect the upper and lower extremities, and I'm going to be checking for muscle tone, any masses, any abnormalities, as well as being sure to check for edema. And I'm going to make sure that I check for edema over the bony prominences, and there is no edema present. Now that I've completed that, I am going to have my Patient, could you please close your eyes for me? And I'm going to take my pen light and I'm going to perform a sensation test, and I'm going to run my pen on various parts of my patient's body. And I'm going to ask my patient to verbalize the location of the touch and the sensation. Patient is able to verbalize the location of the touch and describe the sensation as normal. And now that I've completed that, I'm gonna have my patient do a strength test. So if you could please push your feet against my palm of my hand. Okay, now could you pull your feet against my hands towards you? Okay, perfect. Strength is normal. And also gonna perform a grip test. Okay, could you please squeeze my fingers? Okay, grip is appropriate and even symmetrically. Now I'm gonna have my patient perform a series of range of motion exercises, and that will include my patient, and I'm gonna demonstrate those. So my patient will flex, extend, abduct, adduct, circumduction, supination, and pronation. Okay, and now that I've completed that, I inspected my patient's scalp already. I've inspected my patient's head, their mouth, and their hands. Hands appear to be normal as well. Don't observe any swelling or any abnormalities. Everything appears to be appropriate. Okay, now that I've completed that, I have finished my physical assessment. So I'm gonna place my patient in a more comfortable position. And is there anything else that you need from me today? No? Okay, great. I'm gonna give you your call light, and if there's anything else you need, just let me know, and I will be back within 1 hour to check on you.